Leadership is now required. We immediately demand the reduction of the cost of our health services. In fact, we must make it free for COVID-19 patients. People can't afford to be tested at $65 just for testing. People can't afford to be admitted into hospitals for $2,000 to about $5,000, especially in private hospitals, particularly for those who are in serious conditions. We must decentralize testing, and the rollout. Free testing to rural areas must be provided. Growth points, townships must be centers of testing, including all clinics and hospitals across our countries. Let me now turn to the fourth issue on health workers, their welfare, and their capacity. As you may know, our health workers have done a fantastic job, but they've done it under very extreme circumstances of hardship. We've been seeing our frontline workers fighting this pandemic. However, in order for them to effectively do their job, they need to be capacitated with the necessary tools of trade. According to the Health Service Board, over 1,500 workers, health workers, have already been infected with COVID-19, and 7 deaths have been recorded. This is sad, and may their souls rest in peace. The intermittent and chronic shortage of PPEs is one of the reasons why we have recorded this huge number of health workers getting infected. Recently, nurses at SlyMedia Hospital were protesting over the shortage of PPEs. The situation is similar in other hospitals across the whole country, and more pronounced particularly in the countryside and in other hospitals in Bulawayo and also in Manicaland. PPE should be readily available in order to at least offer protection to our frontline workers. Shortage of health workers is a major reason why we have limited bed capacity for COVID-19 patients. We therefore cannot afford to continue losing health workers either through deaths or through absenteeism from work when infected health workers undergo their mandatory isolation periods. We need adequate remuneration as an incentive, including a risk allowance for our health workers. Our healthcare workers need support. They need our love. They need our comfort. They need national comfort from government. Number 5, the continuous care for other conditions in health. Whilst the attention and focus is on combating COVID-19 pandemic, there's need to continue providing care for other health conditions so as to avoidable morbidity and mortality from other illnesses. Recently, Parenyato Hospital announced that they are scaling down chemotherapy services, and also this is being seen at their radiotherapy center. This severely compromises access to care for cancer patients, as there are only 2 institutions in the public sector offering such important and vital services in the whole country. Measures need to be put in place to make sure that services for chronic conditions such as HIV, diabetes, hypertension, mental illness, as well as access to reproductive health and maternal and child care and health continue during the pandemic. We have experienced above normal rains, and floods this year are going to be a reality, and they are upon us. With the malaria season approaching, there's a likelihood of an increase in malaria cases. People should continue to access services in order to avoid deaths from malaria. As you know, malaria is a major killer in this country and on the African continent. Let me turn to the issue of super spreaders. Fellow countrymen, we have realized that funerals and congested places like prisons have become death zones. They have become serious super spreaders. Our prisons in particular have become COVID super spreaders, hotspots and zones. This is an issue we need to address with immediate urgency and extreme and extraordinary fix-it of purpose. Allow me, fellow Zimbabweans, to touch on an emerging issue on the COVID-19 vaccine rollout plan. We have realized that many countries in Europe, America, Asia have already begun discourse and even vaccinating their populations. In Africa, the vaccinations have not begun in earnest. Many countries, including South Africa and Kenya, have already placed orders for vaccines. While the country is said to benefit from this, the World Organization-backed COVAX scheme, as well as from the arrangements from the AU, these vaccines will not be enough, but also they are important to make sure that we test them before they are administered to our population. They may not be enough for the attainment of herd immunity, which is estimated to be at approximately 60%. There is need for the government to set aside for funds for the procurement of additional support. More importantly, it is necessary for Zimbabwe and indeed Africa to invest into research and development, into our own solutions, to provide homemade and homegrown solutions for our local people. Local solutions are always locally viable. We are a continent with great capacity in intellect, great capacity in our medicinal history and traditions to deal with any disease. We need to invest more in studying the mutating virus and also to avail the best solution which is safe for our people so that we don't just take lock, stock, and barrel solutions that are exogenous, solutions that are imposed on us. Zimbabwe needs to avail funds to development, manufacturing, and procurement of COVID-19 solutions. We have the brains, we have the expertise, we have the skills, we have the people. Our medical doctors are the finest across the continent and across the globe. All we need is to avail funds for them to do the researches within a short space of time. We must also avail funds for treatment of our communities, starting the process of identifying at-risk populations who are supposed to be treated with immediacy. Treatment being administered first to them. For any treatment plan to be effective, priority must be given to the elderly, the vulnerable, people living with disabilities, widows, orphans, and our frontline workers. Having said this, one would say, what is the way forward? Here is our humble submission of the way forward in the best interest of nation development and national contribution. Our national strategy, as far as we are concerned, must be predicated on 6 fundamental pillars. Number 1, there must be a broad-based, inclusive national task force that is composed of all the key stakeholders in our country. Number 2, we need an elaborate, time-tested testing, screening, isolation, and quarantining plan so that we don't just have people without even tracking mechanisms. I like the application that have been used in Australia, in South Africa, where contact tracing is done through applications. We need to go digital and adopt ICTs. That is the future. We must start to have smart solutions to our challenges. Number 3, let us capacitate health institutions and the health workers, particularly our frontline workers. Number 4, let's have lockdowns that are targeted so that we just don't go into lockdowns as a matter of fashion or as a matter of responding to what other people have done. Let's be zonal, spatial, and targeted so that we isolate and target epicenters. Number 5, resourcing strategy through both domestic resource mobilization and our global appeals. We have many friends across the world who may be willing to help us. We need to reach out to them, not as beggars, but as people of goodwill and good standing, in good faith, for them to assist us. Number 6, we want to make sure that we start the unleashing of the 4th industrial revolution, the Internet of Things. This is very important. We must go e-government, e-health, and e-solutions. That is where the world is going, and we must be ahead of the rest because we are the best as Zimbabwe. The Internet of Things is a must. The Internet of Things at household level, in communities, in our schools, at our workplaces, because work styles and lifestyles are changing. And we need to make sure that the industrial revolution, particularly this 4th industrial revolution in information communication technology, is adopted. Karl Marx understood the factors of production, but he didn't understand that there was going to be the factors of communication. Gone are the days when just production was an issue. Now communication is important. The empires of the future, like what was said by Churchill, are the empires of the mind. We need to be ahead of the curve in this regard. Having said that, the following are immediate, and I hereby articulate them. There is need for us, as number 1, to deliberately have an approach that involves all players: political, labor, government, academics, churches, citizens, civil society organizations, private sector, so that we have a united team approach. Our traditional leaders, our war veterans, there has to be a one-team approach. Without a even looking at the shade of political opinion or persuasion. We need to, secondly, establish a national COVID advisory group of experts and let science take the lead so that we have our experts leading from World Health Organization, but also those who are retired, who are very useful. And I know a lot of them whom I have been consulting, who have been helping. We also need to invite WHO and other experts, that is the World Health Organization experts, for an assessment and evaluation of our current national response, to identify gaps, to also understand the things that we need to sort out, to also understand where we have done right and where we need to improve.